How sustainable fiscally is the healthcare district's current structure and business model? And we'll start with you, Mike. Yes. Oh, we'll have 2 minutes each for the questions. Thank you.
We've been doing just that, and if I understand the question, it's how can we sustain the important basic services? And the first thing, the fiscal sustainability, okay. Yeah, I'll change a little bit on that. I'm chairman of the management and finance committee. I have 2 master's degrees, one on Master of Business Administration, and the other one is I taught American history in college for many years. But at present, I am in charge of the board subcommittee that looks into the finances, and we have had a rough couple of years. If you go back, when I first got on board in 2008, we had a couple of years of surplus. We have a net revenue base of approximately $61 million. $6 million of that comes out of the pockets of the owners of property here. So 10% of what's coming in is sustained by the community here. So transparency is really important. The good news is all of the initiatives that we put together are starting off with really good news. We're over budget on both of them. It looks like we'll be back in the black this year. We're hoping. But since it is an ever-changing environment, and that individual mandates will be coming into place 2014, that gives Alameda County 160,000 people who have not been on health insurance that will now have insurance. And there again is an important need for the basic services, trauma, ER, and acute care. Thanks.
I know a little about fiscal sustainability from my years on the school board and from my years in the city of Oakland managing a budget of $2 million and 4 senior centers and about 18 staff. And in Oakland especially, the fiscal sustainability has been a challenge, and we've gone through years and years of budget cuts. I want to say that unlike the school district and to a certain extent even the city of Oakland, the hospital has diverse funding sources. And the great thing that the hospital has been doing lately is to look at the other options for funding for new services, such as the wound care center and the orthopedic service and the skilled nursing facility that they've recently purchased. As Mike mentioned, until a few years ago, there was a surplus until a few years ago, but that was because of one of those funding sources, because Kaiser was doing a lot of their surgeries at Alameda Hospital, and that went away. That just put a big hole in the budget. So with regard to fiscal sustainability, it's critical to have a board that it knows what to look for in services, knows that you can't sustain something on one service, one contract with a provider forever, and knows how to make sure that there are other options addressing the needs of the community. And I know what the community looks like. I know the demographics. I know that there's more seniors. And I think that in terms of future revenue, I know where the cuts are going to be. Unfortunately, the hospital bought a skilled nursing facility, and then the state immediately cut Medi-Cal reimbursement. So that was a reduction right there. The federal government may cut Medicare reimbursement. That's a big part of the budget of the hospital. I know about Medi-Cal, I know about Medicare, I've worked in both programs, and I know that the hospital is moving in the right direction, but with regard to fiscal sustainability and keeping it sustainable, I think that the board really has to have a critical role, similar to the role that I took when I was on the school board, to keep the district in the black.